Chapter 4 is about drugs for the nervous system. We're going to talk about how drugs affect the autonomic nervous system. Autonomic drugs bring about their effects by influencing the sequence of events that involve neurotransmitters. Please remember your neurotransmitters. You should have gone through the review of the nervous system, or you should already know them. Acetylcholine, norepinephrine, epinephrine, dopamine, gamma butyric acid. I believe I said them all, actually. Most autonomic drugs bring about the alteration of events by doing the following. How do they work? They either mimic the neurotransmitters, they interfere with neurotransmitter release, so they don't allow the vesicles to release the neurotransmitter. They block the attachment of neurotransmitters to receptors, so they block on the receptor side, or they interfere with the breakdown, or what we call reuptake, of the neurotransmitters at the synapse. So if you remember, what are those things that break down the neurotransmitters at the synapse to allow them to go back to the axon of the pre-neuron? That would be things like acetylcholinesterase, monoamine oxide, right, or COMT, so catecholomethyltransferase. Okay, so those things interfering with the breakdown of those particular things will keep the neurotransmitter at the receptor site. Cholinergic agents are drugs that stimulate receptor sites mediated by acetylcholine. They achieve these effects by mimicking the action of acetylcholine. These are direct acting if they mimic the action. They are called indirect acting if they inhibit its breakdown. So they act against acetylcholinesterase. Cholinergic agents are also called parasympathomimetic, because their effects resemble those produced by stimulating parasympathetic nerves. There are a number of uses for cholinergic drugs. Cholinergic drugs, you might make a flashcard for this, so cholinergic drugs aid in the diagnosis of myasthenia gravis. They reduce the intraocular pressure of glaucoma. They treat urinary retention. So if an animal can't urinate because it can't contract its smooth muscle of its bladder, this cholinergic drugs are a treatment for that. They also stimulate GI motility and control vomiting. They can act as an antidote for a neuromuscular blocker as well. Acetylcholine is seldom used clinically as a drug because it is broken down so rapidly by acetylcholinesterase. So acetylcholinesterase recognizes acetylcholine for what it is and breaks it down quickly. Carbamylocholine treats atony of the GI tract, so it makes it move faster, and it's used to stimulate uterine contractions in swine. So carbamylocholine is a direct acting cholinergic drug. It acts and looks like acetylcholine. Bethanechol or urocholine treats GI and urinary tract atony. So this is something that if we have an animal, a cat, that has been blocked for a period of time, it will not it cannot contract the bladder because it's been so overstretched. So we will give this cat bethanechol so that the bladder will contract and the pet can urinate. Pilocarpine is something used in the eye for intraocular pressure associated with glaucoma. And metoclopramide we're going to see a number of times as we learn about different drugs. In this case, we are classifying it as a cholinergic drug. So metoclopramide is a cholinergic drug. It stimulates gastric tract emptying in the upper GI tract. So it helps to control vomiting and to get things moving in the upper GI tract as a direct acting cholinergic drug. Indirect acting cholinergic drugs. So this is a separate category. You need a separate flashcard for this. These are things that act as anticholinesterase agents. Edrophonium is used to diagnose myasthenia gravis. Neostigmine and physostigmine are used to treat urine retention in GI atony and as an antidote for neuromuscular blockers. Demicarium is humarsol, which is the management of glaucoma, so it's an eye medication. Pyridostigmine is for the treatment of myasthenia gravis, and organophosphate compounds. So we know these organophosphate compounds are insecticide dips. Things that we use as insecticides. They can result in toxicity if they're used inappropriately, especially in cats. So organophosphate compounds are anticholinergic agents. They're indirect acting cholinergic drugs. It is important that you know the difference between direct acting and indirect acting cholinergic drugs. Some adverse side effects of cholinergic drugs can cause low heart rate, heart block, and hypertension, will increase tearing, so lacrimation and bronchial secretions, can cause diarrhea and vomiting, and increased intestinal activity with possible intestinal rupture. Think about metoclopramide. Cholinergic blocking agents or anticholinergic drugs, it's a very small group, they block the action of acetylcholine at the muscarinic receptors of the parasympathetic nervous system. So this is atropine, glycopyrrolate. So when you think anticholinergic, you're thinking atropine, things that block the parasympathetic nervous system. They act more like a sympathetic neurotransmitter. Sometimes when we would use anticholinergic drugs, treatment of diarrhea and vomiting because it decreases GI motility. Pre-anesthetic to dry secretions and prevent bradycardia, to dilate the pupils for ophthalmic examination, to relieve ciliary spasm of the eye. Ciliary spasm are the ciliary muscles contracting and changing the lens size, and as it spasms, that can cause a lot of pain in your eye. Treat sinus bradycardia. An interesting fact about anticholinergic drugs, the belladonna alkaloids of the deadly nightshade family of plants have been used as drugs for centuries and represent the prototype for this category of agents. So belladonna. Atropine, glycopyrrolate, these are both common pre-anesthetic medications that we use to dry secretions and prevent bradycardia. It's used as an antidote to organophosphate poisoning. So if it's anticholinergic, then we can use it to treat any overdose or toxicity of a cholinergic drug, whether it's indirect acting or direct acting. So this is something we can use to treat organophosphate poisoning. Dilate the pupils for an ophthalmic examination, control ciliary spasms, treat sinus bradycardia, and slow a hypermodal gut. Glycopyrrolate is a quaternary ammonium compound that acts similarly to atropine. It has a longer action than atropine and is used primarily as a pre-anesthetic. It's also more expensive than atropine. Scopolamine and methscopolamine are antidiarrheal medications. Aminopentamide controls vomiting and diarrhea in dogs and cats. Propanthyline is a quaternary ammonium compound that's used to treat diarrhea, urinary incontinence, and bradycardia, and to reduce colonic peristalsis in horses to allow rectal examination. Pralidoxime is a cholinesterase reactivator used to treat organophosphate intoxication. So it is something that it's not an anticholinesterase, okay? It promotes cholinesterase activity to knock the indirect acting choline, indirect acting organophosphate, to keep it from doing its job. So it's an antidote for that. Side effects. Some side effects would be, and they're dose related. So if you're giving too much, it can cause drowsiness, disorientation, tachycardia, photophobia, anxiety, constipation, and burning at the injection site. So you just need to think through these and think that if we're giving too much of an anticholinergic, we're actually causing a sympathetic reaction, and so this is what it's going to cause. So pathomimetic agents are adrenergic agents. So these are things that are going to cause the fight or flight response. They're usually mediated by epinephrine or norepinephrine. They can be classified as either catecholamines or non-catecholamines. In either category, they can also be classified as according to what specific receptor types they activate. So alpha 1, alpha 2, beta 1, or beta 2. And what I'll be having you do is to draw a character that signifies what alpha 1, so an alpha 1 superhero, what does it interact with, or what does it cause within the body, so that you understand these receptors and what they do more clearly. So alpha receptor causes an excitatory response except in the GI tract, and beta stimulation causes an inhibitory response except in the heart. Some clinical uses of adrenergic drugs: they stimulate the heart to beat during cardiac arrest, reverse the hypotension and bronchoconstriction of anaphylactic shock. They strengthen the heart during congestive heart failure. They correct hypotension through vasoconstriction, reduce capillary bleeding through vasoconstriction, reduce mucous membrane congestion through vasoconstriction in allergic conditions. They prolong the effects of local anesthetic agents by causing vasoconstriction of blood vessels at the injection site, thereby prolonging their absorption. So we might use epinephrine with lidocaine to keep that lidocaine in place longer. They also are used to treat glaucoma. This alpha stimulation increases outflow of the aqueous humor, and beta stimulation decreases the production of aqueous humor. It's also used to treat urinary incontinence. So we talked about cholinergic drugs treating urinary atony, meaning that the bladder is able to contract. In this case, we're allowing the bladder to close down at the skeletal muscle and keep the urine in versus allowing the urine out. Epinephrine or adrenaline stimulates all receptors, and it increase in heart rate, cardiac output, vasoconstriction in the skin, but vasodilation in the muscles. So we're going to run really fast, but we might be pale. Dilation of the bronchioles and an increase in metabolic rate. Norepinephrine is an alpha stimulator with some beta stimulation. It also raises the blood pressure, and we call that vasopression, or call it a vasopressor. Isoproterenol is a pure beta stimulation. It causes bronchodilation. Phenylephrine or neosynephrine is an alpha stimulator. We use this drug up the nose to cause nasal vasoconstriction. What does that do? That decreases the inflammation in the nose and decreases congestion in the nose. So that's something that we can use if an animal's really congested. Dopamine is an emergency drug that we often use. It's a precursor of epinephrine and norepinephrine. The action is dose dependent, and it's used to treat shock and congestive heart failure and to increase renal perfusion. Phenylpropanolamine, or PPL, or PPA. It's known as Oronate prolamine dexatrim. That's a diet pill. It treats urinary incontinence in dogs by increasing the urethral muscle tone, so it's more of a skeletal muscle. Dobutamine is a beta-1 agonist, and we can use it as short-term treatment of heart failure in emergency situations. Ephedrine, terbutaline, which is breathine, albuterol, these are all asthma drugs, and these are beta agonists. They cause bronchodilation. So again, really, really important that you know by heart and within your soul what alpha and beta receptors do. Some adverse effects of adrenergics. So if we're going to use adrenergics, we're going to expect the fight or flight to be activated. Tachycardia, cardiac arrhythmias, hypertension, and nervousness. If we overdose them, we'll see hypertension, arrhythmia, and pulmonary edema. So here's ODing. We've got frothing at the mouth from pulmonary edema. It's all coming out. And could actually, the arrhythmias could cause collapse or death. Adrenergic blocking agents, these disrupt or inhibit the activity of the sympathetic nervous system. They're classified according to their site of their action as an alpha blocker, a beta blocker, or a ganglionic blocker. Remember, we have that ganglion synapse that connects the CNS, the spinal nerves, to the target tissue. They usually block only one category of receptor. Phenoxybenzamine is a hypotensive agent, a vasodilator. So it opens up blood vessels. It treats laminitis in horses and urethral obstruction in cats. So it opens up that urethra. So it's going to do the opposite, right, of the adrenergic drugs that we saw. Tranquilizers, acepromazine, and droperidol is an alpha-2 agonist. They are alpha blockers and they cause vasodilation. I want you to remember what ACE eyes look like. So if you see an animal that's under the influence of acepromazine, their eyes are droopy and you can see the conjunctiva around their eyes are really red. That's vasodilation. So it's an alpha blocker causing vasodilation. Prazosin, called Minipress, is a hypotensive agent. Yohimbine is an antidote for xylazine toxicity. Atipamezole or antecedin is a reversal agent for metatomidine. So these alpha blockers are also antidotes. Some adverse side effects. Adverse side effects cause it can cause hypotension. Phenoxybenzamine, tranquilizers, and prazosin cause hypotension because they open up all the blood vessels. They can cause tachycardia because they are adrenergic blockers, and that's phenoxybenzamine. Muscle tremors, yohimbine can cause muscle tremors, and seizures. Acepromazine can lower the seizure threshold and cause seizures. Some beta blockers. What do we use beta blockers for? Glaucoma, arrhythmias, so in eyes and hearts, and hypertrophic cardiomyopathy, which is that thickening of the heart. Okay, so here is eyes, arrhythmia, and hypertrophic cardiomyopathy. So all beta blocker drugs end in OLOL, O-L-O-L, OLOL, propranolol, atenolol, and timolol. Propranolol and atenolol help to treat cardiac arrhythmias and hypertrophic cardiomyopathy, so those are the heart drugs, and timolol treats glaucoma. Some side effects would be really slow heart rate, heart block, and syncope, which is when we don't get enough cardiac output to get to the brain. It can cause hypotension, it can cause worsening of heart failure for giving it the wrong way, and it can cause bronchoconstriction. So we would have to be very careful using something like propranolol or atenolol, or even giving timolol to somebody who has asthma. So we want to be really careful about that with beta blockers. The central nervous system. The drugs that we use in the central nervous system are used to tranquilize or sedate animals. So these are depressants. They're used to control pain, to induce anesthesia, and to prevent or control seizures. Some CNS drugs antagonize or reverse the effects of some depressant drugs as well, so they'll block it. Some stimulate the CNS to treat cardiac or respiratory depression or arrest. And then some euthanasia drugs are also considered central nervous system drugs. Drugs that affect the CNS generally cause depression or stimulation. They're thought to generate these changes by altering nerve impulse transmissions between the spinal cord and the brain or within the brain itself. Altering impulse transmissions within the thalamus could prevent messages regarding painful stimuli from reaching interpretation centers within the cerebrum. Interfering with impulses within the reticular activating system could alter levels of Now remember back to what the reticular activating system is responsible for doing. It can alter levels of consciousness. It's responsible for wakefulness, right? Classes of CNS drugs. So now here's where we're going to start to put our flashcards into different categories. We need flashcards for tranquilizers, one for barbiturates, one for dissociatives, one for opioid antagonists, one for opioids agonists, and one for antagonists, one for neuroleptic analgesics, and one for antagonists, and then drugs that to prevent or control seizures, so anti-seizure medication, inhalants, CNS stimulants, miscellaneous CNS drugs, and euthanasia agents. So you need to have a category and a flashcard for each of these. We're going to list those, and then in those categories, you're going to take each drug and understand a little bit more about them. We don't really know the mechanism of action for some of these drugs. They may be dopamine blockers. They produce sedation and allay fear and anxiety, but don't produce significant analgesia or pain relief. Sudden painful stimulation will arouse the animal, so they can, if they're very painful, some of these medications will not work. They do have an antiemetic effect by depressing the chemoreceptor trigger zone in the brain. Remember that chemoreceptor trigger zone in the brain is very close to the reticular activating center, so it could affect both of those. They also have an antipyretic effect, which means they will cause things to be less itchy. They reduce the tendency of epinephrine to induce cardiac arrhythmias. They're generally a relatively safe drugs when administered appropriately, but they should be given with care if you're using other CNS depressants because of the additive effect. This is why we use combinations of drugs at lower doses. When phenothiazine derivative tranquilizers are metabolized by the liver and or most of these are metabolized by the liver and excreted by the kidneys. So we're talking about tranquilizers and specifically right now phenothiazine drugs. So these tranquilizers are phenothiazine drugs, and this is acepromazine, causes sedation. Chlorpromazine or thorazine is anti-nauseous, but it can cause sedation. Promazine is anti-nausea, but it can cause sedation. And prochlorperazine or isopropamide are both anti-nausea, but also cause sedation. So acepromazine is the one that we use for sedation primarily. The other ones we use for anti-nausea, but can be used for a little bit of sedation as well. Some adverse effects to phenothiazine can cause hypotension, remember severe vasodilation, and hypothermia. So if you have severe vasodilation, the heat is going to escape the animal. So it's doing this by blocking alpha receptors. They're alpha agonists. They can induce seizures by lowering the seizure threshold in epileptic animals. Next category of sedatives, tranquilizers, sedatives. These are benzodiazepine derivatives. Their mechanism of action is to depress the thalamic and hypothalamic areas of the brain. So they're going to decrease the connection between the brain and the perception of what's going on in the cerebrum. So they're going to be helpful with some analgesia. Also, they're going to decrease some of the effect of stimulation of the hormones, so they're going to be anxiolytic as well. So sedation, muscle relaxation, appetite stimulation in cats, and anticonvulsant activity. We can use these with ketamine for short-term duration. An example of a benzodiazepine, it will cause minimal respiratory depression, can be used with animals actively seizing, and also as an injectable anesthetic. So you need to think what could be a benzodiazepine that we use for this. The answer is diazepam, Valium. You can see that this is kept in a brown bottle. Any medication that you see kept in a brown bottle means it's sensitive to light. So once we draw it out, we want to give it pretty quickly. Some adverse side effects, they're usually limited when we use it as directed. In some dogs, we can see excitement, and an overdose may cause excessive CNS depression. So some drugs cause an opposite effect for some reason in some animals. So this is a picture of a couple of dogs that look kind of excited, just to remind you that Valium or any benzodiazepine can cause some excitement instead of sedation. So it's just an individual response. They should be stored at room temperature and protected from light. Diazepam should not be stored in plastic syringes or in solution bags because they are absorbed into the plastic. They also should not be mixed with other medications or solutions. If you're going to do that, do it right before you give the injection. It's metabolized by the liver, eliminating the kidneys like most. Alprazolam is a benzodiazepam that's used as an appetite stimulant. There are other benzodiazepines. Diazepam is the one we remember. Tolazepam uh, is another one, or toletamine. And midazolam, those are also benzodiazepam. They all end in AM. Xylazine is an alpha-2 agonist. It is a sedative, analgesic, and muscle relaxant properties. It's approved for use in dogs, cats, horses, deer, and elk, not for cattle. They are very sensitive to it. This agent causes vomiting in a large percentage of cats and in some dogs. Xylazine is antagonized by yohimbine. So if you remember xylazine, you got to remember yohimbine. There's a really good meme out there with Harry Potter and Voldemort pointing their wands at each other, and one is shouting the drug and the other one is shouting the antidote. I will try to find that for you and post it on your eLearn course. But xylazine and yohimbine go together. It produces effective analgesia in horses. We use it often in horses, and it's used for treating the pain associated with colic and for sedation for minor procedures. Xylazine in horses is really interesting because in draft horses are super, super sensitive to it. And what I can use in a draft horse is about half or less, and if it causes the same effect as I will see in a regular horse, not a draft horse. So there are some species that are more affected. Donkeys are not as affected by xylazine as horses are. It's used in combination with ketamine for short-term field procedures such as castration and suturing, but we only expect that they're going to lay down for about 15 to 20 minutes. We got to be fast with what we do. We can use xylazine for some procedures in cattle, but it's a tenth of the equine dose. We don't use it often. Xylazine is used in cats and dogs as a tranquilizer and in combination with other injectable agents for surgical procedures. You don't see it used a lot in small animal. So we use it for sedation, analgesia, short-term anesthesia if it's combined with something else, and if we need to induce vomiting in a dog or a cat. Side effects would be bradycardia, hypotension, respiratory depression, and an increase in sensitivity to epinephrine, which will result in cardiac arrhythmias. Some dosage forms for small animal, it's 20 mg per mil, and for large animal, it is 100 mg per mil. So you have to look at the dosage form that you're giving and make sure it's correct for what you're using it. Known as Rompin, Anised, Gemini, or Cetazine. Not concerned that you know this information, just you may have seen it before. Because of the potential of xylazine to cause bradycardia or heart block in dogs, we want to use atropine as a pre-med when we're using xylazine with dogs. Horses can appear heavily sedated, but still respond to painful stimuli by kicking, so you need to be careful. Little story, I sedated one of my horses to clean his, he had some heel bulb infections, and I was cleaning them, so I sedated him with xylazine and was in the wrong position as I was scrubbing him, but he was really out. But I was in the wrong position, and all of a sudden he picks up his foot. Didn't really kick, but he picked up his foot into my face. So you want to be very, very careful because they will still respond. So be very careful also to make sure that if you're sedating a small animal, you're using the right dose, and if you're using the large animal, doing the large animal, you're using the right dose. Okay, another group, ditomidine, is similar to xylazine. It's also an alpha-2 agonist, and we use this as a sedative and analgesic for horses. It's a little bit better for horses with their legs, especially with their rear limbs. So this is a choice that I would make now to sedate this particular horse, for working anything with the limbs. It can cause sweating, muscle tremors, penile prolapse, and bradycardia or heart block. We want to use very carefully with other sedative drugs, and we should not be used with potentiated sulfa drugs. This is an antibiotic, or trimethoprim sulfa. These are medications, antibiotics that we do use frequently in horses, so we have to be careful about that. Medetomidine is called Domitor. It's an alpha-2 adrenergic agonist like xylazine and like ditomidine. It's a sedative and analgesic that we use in dogs, anything older than 12 weeks. So we might use it for minor surgeries, but again, we have to be careful to muzzle them because they will still respond to painful stimuli. We can use it for minor dental procedures if we don't. We have to be very, very careful though, because there's no intubation with this. So we don't want to put any fluid in there, and we want to use a mouth gag so they can't close their mouth and bite you. Some side effects would be bradycardia, although the hemodynamics are maintained, so their heart is beating slower, but their blood pressure remains the same. AV heart block is something we have to be concerned about as well. That means that there's the atria don't stimulate the ventricle to beat, and so there can be an arrhythmia that occurs. Decreased respirations are a concern, hypothermia, urination, vomiting, hyperglycemia, which is not as dangerous, and pain at the injection site. Treatment of medetomidine-induced bradycardia, you cannot treat that with an anticholinergic like atropine or glycopyrrolate, because that will lead to arrhythmias. So what we do is we give them the reversal agent. We're going to give them some atipamezole or antecedent, and we're going to make sure that we are looking at medetomidine very carefully and not use any other sedatives unless we have the right dosages, because we'll get an increase in potential side effects if we're not using the right combination. All right, moving to a completely different group. Okay, this is not alpha-2 adrenergics anymore. These are barbiturates. This is the oldest category of depressants in veterinary medicine. They are derived from barbituric acid. The response is sedation to death, depending on the dose and the circumstance. They're used as sedatives, anticonvulsants, general anesthetics, and euthanasia agents. They are easy and cheap to administer, but they have a great potential for complications. So they have potent depressing effects on the cardiac and pulmonary systems, especially in cats. So we're not going to use this in cats. It's non-reversible and has to be metabolized by the liver before elimination can occur. So if the liver is not functioning normally, it's not going to leave the system. It's also non-reversible, so not as safe as some other medications. In patients that have poor liver function, like I said, or little body fat, they're very skinny, or pre-existing illnesses that cause acidosis, they're going to be more at risk when they receive barbiturates. Barbiturates are alkaline, and the short-acting, ultra-short-acting barbiturates can cause necrosis of the tissue if we administer it outside the vein in the subcutaneous space. So it absolutely has to go in through an IV catheter that has been checked. Again, it's metabolized by the liver, and they really depress the respiratory system. So these are actually not super safe drugs. They've been around for a long time. They're still used because they're cheap, but it's not necessarily something that we're going to grab for sedation. We do have different classes of barbiturates. There are long-acting, short-acting, and ultra-short-acting. The long-acting and short-acting are both oxybarbiturates. They have an oxygen side chain, so this is the general structure. Okay, so this is what phenobarbital looks like, and this is what pentobarbital looks like. Phenobarbital is something used for anticonvulsant. Pentobarbital is used for euthanasia. It used to be used for anesthesia, but with a higher dose, we actually improve on those respiratory depression effects and the bradycardia effects and can cause euthanasia. So anyways, we have oxygen side chains with this, and this is ultra short acting have sulfur side chains. Thiobarbiturates are highly soluble in fat and move out of the CNS into the fat stores. They are safer to use in thin dogs like greyhounds or other sight hounds. Clinical uses: prevention and treatment of seizures, sedation, anesthesia, euthanasia. We do not use it as much for sedation and anesthesia because it's much more difficult to control. Can cause excessive CNS depression, paradoxical CNS excitement, so it can go the other direction, depends on the individual, severe respiratory depression, and cardiovascular depression. And we also need to be careful about tissue irritation with these thiosulfur thiobarbiturates. So we're going to use a catheter. Phenobarbital. This is a long-acting barbiturate, so it's going to go 8 to 12 hours. There are a lot of products available. It is a class 4 controlled substance. We can give it orally, or they do sell it as an injection. So if we have an animal that's actively seizing, we have an IV catheter and we can give that. So anticonvulsant phenobarbital. Pentobarbital is used. It's a short-acting barbiturate. It can last for 45 minutes to an hour and a half if we're using it for anesthesia at an anesthetic dose, or it can last forever if we're using it as a euthanasia solution. We're going to give it IV or IP to get 1 to 2 hours of general anesthesia. In the early days of veterinary anesthesia, it was the general anesthetic that was routinely used in dogs. But now we use it to control seizures in progress and as a euthanasia solution, agent. IV administration of glucose or concurrent use of chloramphenicol may prolong the recovery period. It is a class 2 controlled substance because it is dangerous. I have it as class 2, but I actually believe it is class 3. And I'm looking at the bottle. It's class 3 if it's used as a euthanasia solution. So that is a class 3 controlled substance. I have used euthanasia solution to control seizures before. You obviously have to decrease the dose and give it as a constant rate infusion. Thiobarbiturates or thiopental, we use these with sight hounds. We want to give it IV, so directly into a catheter. It's redistributed to the body fat within 5 to 30 minutes, so it goes very quickly. We have to be very careful when we're giving it to a thin animal, but it is the one that we do tend to use for sight hounds. They can be stable for long periods in their undiluted form, but they're usually provided as a sterile powder that we then put together with the sterile water as the diluent. We don't want to give it if there's any precipitates present, so we need to make sure it is fully dissolved in solution. We do need to ventilate these patients because it can cause severe respiratory depression. We may have this CNS excitement stage 2 if we give it too slowly. Recovery from pentobarbital is often prolonged, could be forever, remember, and dogs exhibit paddling limb movements during this time. So we may have to give additional doses of thiobarbiturates, or if we give additional thiobarbiturates, it's going to further prolong it. Thiobarbiturates should not be used in sight animals. We actually use the short-acting, except for methohexital or brevane. Methohexital is an ultra short acting barbiturate that produces 5 to 10 minutes of anesthesia. It is recommended for sight hounds because it rapidly redistributes and goes to the liver for metabolism. Always remember that these guys are potent depressors of the respiratory system, so they stop breathing very well. That's why we use them for euthanasia solution. So thiobarbiturates in general should not be used in sight hounds except for, remember this, methohexital. That may come up. All right, another category are dissociative agents. Dissociative agents make the animal feel super funny, okay? It's a cyclohexamine family. Ketamine and taletamine are two of the um, uh, things that we see. So it's actually zolazepam is the benzodiazepam. But diazepine, taletamine, we often mix with zolazepam to get something we call tilazol, if you've ever seen that, and that is a combination of taletamine, which is this dissociative agent, plus zolazepam, which is a benzodiazepine. This causes involuntary muscle rigidity. We call this catalepsy. The muscle tone is increased. That may increase their temperature as well. It will cause amnesia and analgesia. So we do get some pain relief, but they are somewhat aware still that something is going on, but they can't control anything. We do maintain pharyngeal and laryngeal reflexes so they can swallow. We don't intubate them with just strictly ketamine on board or taletamine on board because they have maintained some of their reflexes. We can't get a tube into them. Deep abdominal pain is not eliminated. So castration is actually deep abdominal pain. Think about where those testicles are attached. Spay is a deep abdominal pain. So we should not be just using ketamine or taletamine when we're doing those procedures. We're not reaching surgical stage 3 in the anesthetic plane. So we only want to use it for restraint, diagnostic procedures, minor surgery, unless we combine it with other agents, and it often is combined with other agents. Might get some minor cardiac stimulation and some respiratory depression if we have higher doses. The mechanism of action is depression of the thalamus and the cerebral cortex. Some species are ataxic and hyperresponsive during induction and recovery with dissociative agents. We might see tremors, spasticity, convulsions at higher doses, and then hallucinations have been reported in humans and are suspected in cats. We use ketamine, Ketoset, Vitalar, Ketalar. It's approved for use in humans, primates, and cats, but also has extra labels in other species, including dogs, horses, birds, small ruminants, and reptiles. Tranquilizers such as acepromazine, xylazine, and diazepam are often used concurrently with ketamine to enhance muscle relaxation, because we don't get it with ketamine, and to deepen the level of anesthesia. This is a cat that is dissociated. It has ketamine on board. You can tell because its eyes are wide open and they're very dilated. We see oral, ocular, and laryngeal reflexes maintained when ketamine is used alone, except at high doses. Occasional spastic jerking movements can occur in cats. We get some somatic analgesia, but poor visceral analgesia. And I will say again, castration is visceral and it is abdominal pain. So I've said the reason I say this is I've seen cat castrations with just ketamine on board. Keeps the cat still, but they still feel the pain. Not appropriate. Increased salivation can accompany the administration of this drug, so we can control it with atropine or glycopyrrolate. We want to put an ophthalmic lubricant. Their eyes are wide open. They cannot blink, okay, or they don't blink too as often, so we want to make sure that we put a lubricant in. This is a class 3 controlled substance. Taletamine, if we add zolazepam, which is a benzodiazepine with it, is called tilazol. It's approved for use in dogs and cats. It's Teletamine is similar to ketamine. Diazepam is used for that muscle relaxation and increased analgesia. And again, we want to use lubrication when we use that. It's class 3 as well. Some adverse side effects at high doses: spastic jerking movement in cats, this is spaz here, convulsions, respiratory depression, burning at the intramuscular injection site, which you should remember because every time you have to give this injection to cats as a pre-medication, you have to hold them facing inside the cage and let them go as soon as you give it, right? They also have drying of the cornea, but we can control that by lubricating that cornea. Metabolites of the dissociative agents are excreted through the kidneys as normal. So these drugs may be contraindicated if we have compromised kidney function. Opioids, opioid agonists. These are drugs that cause an overall good feeling in the body, analgesia, sedation, reduce anxiety and fear. Any compound that's derived from the opium, poppy, alkaloids, and synthetic drugs with similar pharmacologic properties. So analgesia and sedation, kind of a hypnotic thing. They can come out of it. They're not completely asleep. And it also reduces anxiety and fear. It's used as pre or post anesthetics. We see narcotic effects that are produced in combination with opiate receptors at deep levels of the brain, in the thalamus, the hypothalamus, and within the limbic system. Sedation is more pronounced at higher doses. Sometimes they're used alone or in combination with tranquilizers as anesthetics for surgical procedures, for relief of colic pain in horses, and for restraint and capture of wild zoo animals. Now, a big part of that with wild and zoo animals is that it reduces anxiety and fear. And when we see an increase in stress, anxiety, and fear in these zoo animals, we can get an opposite effect. They'll overcompensate for it with their sympathetic nervous system, and it will actually cause an overload and kill them. So we want to reduce that anxiety and fear as much as possible. At low doses, opioids are used as antitussive, so anti-cough. We'll see this again in respiratory, and anti-diarrheal. We're going to see it again in GI. So they're going to reduce peristalsis or segmental contractions in the GI system. Receptors are where these agonists will work. So the mu receptor contributes to pain relief, euphoria, respiratory depression, physical dependence. So this is a problem. Okay, so you are physically dependent on opioids if you overdo it, right? And can cause hypothermic reactions, so it can reduce the body temperature. Kappa receptors are found in the cerebral cortex and spinal cord, and they contribute to analgesia, sedation, meiosis. Meiosis is constriction of the pupil. Sigma are responsible for struggling, whining, hallucinations, and mydriatic effects, so we don't want to stimulate those sigma receptors. And then delta receptors modify mu receptor activity. Where you're going to see the agonists work most often, or what they affect, are mu receptors and kappa receptors. Adverse effects of opioids, they're also called narcotics, opioid agonists. They're respiratory depressants. They affect the thermoregulatory centers in the brain. They may cause panting, defecation and flatulence, vomiting, sound sensitivity, and excitement in dogs if it's given rapidly IV. So we want to slow it down. Okay. Notes: cats and horses are sensitive to opioids and may exhibit excitatory effects at high doses, so they go the opposite direction. Because opioids cross the placenta fairly slowly and their effects can be antagonized, so we can reverse them, they're useful as pain relief and pre-sedation when a cesarean section is performed, so that it won't affect the offspring. We can give the offspring, if they're really depressed, we can give them a little bit of the antidote. Liver metabolizes opioids, and resultant metabolites are eliminated in the urine as usual. Some of these are class 3, some of them are class 2. So we have to remember which is class 3 and which is class 2 because they go into different logbooks and they're ordered differently. Narcotic antagonists can block and reverse them. So the first one we're going to talk about is laudanum. That old-timey medicine that you see in historical novels is opium. It's a paregoric. Opium is derived from the seed capsule of the opium poppy. It was originally used as an antidiarrheal, still used in calves in foals. So as an antidiarrheal, laudanum was used, and then people started to misuse it. Morphine sulfate, or Duramorph, is for severe pain as an anesthetic or pre-anesthetic, especially for C-sections, anxiolytic in acute congestive heart failure. It affects mu receptors, and it is a class 2 medication. Oxymorphone is semi-synthetic, it's partially synthetic. It's a mu agonist. It is 10 times more potent than morphine. This is Oxycontin, folks. Okay, so this is that really, really potent opioid that is now off the market. Dogs we use for restraint, diagnostics, minor surgery combined with tranks for neuroleptic analgesia. So when we combine tranquilizers with like xylazine with an opioid, we call that neuroleptic analgesia. So if I ask you to define it, it's going to be tranquilizer plus opioid. Naloxone is the antagonist. Naltrexone is the antagonist. Butorphanol tartrate is synthetic. It is partial agonist-antagonist, opioid agonist slash antagonist. Okay. Times the morphine potency. It is a class 4 substance because it has some partial antagonist activity. Dogs and cats, we use it as an analgesic, pre-anesthetic, antitussive, and combined with other sedatives or tranquilizers for minor procedures. In horses, we can use for colic pain and combine it with sedatives and tranquilizers for minor procedures. Fentanyl. Fentanyl is 100 times more potent than morphine. This is a highly controlled substance. It's used for analgesia. It's very good for pain relief. It's transdermal, or CRI. It has a very short duration of action, so we need to have some type of constant flow of this medication into the body. Buprenorphine is a partial mu. It's an agonist, mostly agonist. It has a little bit of antagonist property as well. It is a potent analgesic used, I'm going to sort of cross that off. It's used in several small animal species, so Buprenix. Apomorphine. Apomorphine is that little tablet you can put in the conjunctival sac that causes vomiting when we have a toxin. We also give it IV. It's more often given IV these days. It induces vomiting by stimulating chemoreceptor trigger zone in the brain, but it also is a narcotic. Some adverse side effects. We can see respiratory depression, excitement in cats and horses, nausea, vomiting, diarrhea, defecation, panting, convulsions. Overdose causes profound respiratory depression. So we can use opioid antagonists. They bind with the opiate receptors, displacing narcotic molecules and preventing them from binding at the sites. There can be pure antagonists or partial antagonists. Partial antagonists have some activity, analgesic and respiratory depressant effects. So they're going to have some analgesic effects, but it's going to get rid of the more severe effects. So we usually give these IV, or we can give them, if it's Narcan, we give it up the nose, and they act within 15 to 60 seconds, so very, very quickly. Naloxone is a pure opioid antagonist. It's chemically similar to oxymorphone and has a high affinity for mu receptors. It has no agonist activity, so once you give it, all the opioid is gone. Nalorphine is a partial antagonist and can produce untoward analgesic and respiratory depressant effects, so it can be not as effective. Buprenorphine is a partial mu agonist and partial antagonist. They can be used as an antagonist, and then actually butorphanol is a partial agonist antagonist that antagonist to knock out some of the worst effects of morphine or one of the higher mu receptor agonists, and then replaces it with some kappa um, activity that also produces some pain relief as well. Neuroleptalgics are opioids plus tranquilizers. So when we're combining fentanyl and droperidol, this is Inovar-Vet. It's the only commercially available neuroleptalgic. It is expensive, so we don't see it used very often. Used for restraint, diagnostic procedures, pre-anesthetic, and minor surgical procedures. We can make our own using acepromazine and morphine, or acepromazine and oxymorphone, or xylazine and butorphanol, or any number of combinations. We're going to use this in the same way as Inovar-Vet. Some adverse side effects when we use neuroleptalgics would be panting, flatulence, they might defecate, personality changes, increased sound sensitivity, slow heart rate, and they may or may not remain conscious. Drugs that are used to control seizures. Seizures occur in animals for various reasons, but they could be idiopathic, infectious, so post-distemper viral infection, traumatic from a head injury, toxicity from a poisoning, that's actually fairly common, and then metabolic, like heat stroke can cause this. Prolonged seizures in progress require emergency action with IV therapy. Periodic recurring seizures require preventive oral medication every day for life or until the seizure activity has decreased significantly. Oral preventive therapy must be titrated or managed for the individual patient and reviewed regularly for the appropriate dose adjustment. So we're going to need to check this at least every 6 months. And we're going to check the level in the blood at the lowest that is in the blood. Okay. Some anti-seizure drugs. Diazepam, a benzodiazepine. It's used as an IV tranquilizer or rectally, and it has a very short duration, just 3 to 4 hours. So we're not going to use this a lot. Pentobarbital is an IV short-acting barbiturate, 1 to 3 hour duration. Phenobarbital, we typically give oral to dogs and cats, could be injectable as well. We can most often use that for foals. It's a 6 to 12 hour duration, so we may give this 2 to 3 times a day. We do expect that the pet will be drowsy. This is a class 4 controlled substance. Bromide or potassium bromide is an adjunct that we can use in combination with either phenobarbital or primidone. But it can cause pancreatitis, so we do have to be careful with it. Primidone is similar to phenobarbital, and some of it is metabolized actually to phenobarbital in the liver and then used as phenobarbital. We do use this in dogs and cats, although it's controversial in cats. We want to consult product inserts or appropriate references for specific effects. Inadequate client compliance is a frequent cause of failure of anticonvulsant therapy. So we want to have them follow the medication instructions carefully and get into a good habit of giving those pills at least twice a day. Reserpine and phenothiazine drugs should not be given to epileptic animals because it reduces the seizure threshold. They're more likely to seize. Adverse side effects, drowsiness, CNS depression. They can get anxiety or agitation, polyuria, polydipsia, so they eat more, or they drink more, and pee more. We can see dermatitis, hepatotoxicity, especially with phenobarbital and primidone. Inhalant anesthetics are used to produce anesthesia, right? Or unconsciousness. They're converted from a liquid to a gaseous phase by anesthetic vaporizer and delivered to the lungs with the use of a delivery or anesthetic machine and a patient breathing circuit. From the alveoli of the lungs, they are absorbed into the bloodstream and delivered to the CNS, where they produce unconsciousness, analgesia, and muscle relaxation through mechanisms we don't fully understand. Inhalants generally require little biotransformation for elimination from the body. So generally they enter and exit the body through the lungs, and this facilitates a rapid induction and recovery from the effects of the agent compared with injectable anesthetic agents. So it permits a quicker alteration of depth of anesthesia. Some factors, and this should be some review, and if you think back to, and you can always go back to my YouTube on veterinary anesthesia, which is chapter 31 of McKernan's book, so you go back to that YouTube lecture if you like. But the factors that influence the removal of the agent from the lungs include how soluble they are. What is their blood gas partition coefficient? Do they go from the air and back into the liquid easily or not? Also, the molecular weight of the agent. So the bigger it is, the harder it will be to get into the bloodstream. The partial pressure difference between the agent in the alveolus and the agent in the blood. So how much concentration of that agent do we need to get into the alveola before it gets into the blood? That's the minimum alveolar concentration, or MAC. The amount of alveolar surface available for exchange, so we don't want to have any lung pathology. Anything that is clogging up the lungs is going to reduce the amount of gas that we can get into the system. Also, cardiac output has a lot to do with it because the movement of blood through the lungs is important. The uptake by tissue of the anesthetic agent depends mainly on the degree of tissue perfusion and solubility of the agent in the tissue. So it needs to get from the lungs through the blood to the tissue. Vessel-rich tissue like the brain, the heart, the lungs, the liver, the kidney, the intestines, and endocrine glands receive the greatest percentage of cardiac output and is consequently the first to reach equilibrium during uptake of the anesthetic gas and the first to download or release the agent. Lipid-rich cells, similar to brain cells, absorb more agent than do lipid-poor cells. Characteristics important to understanding inhalant agents include MAC, minimum alveolar concentration, partition coefficient, and vapor pressure. Lower numbers indicate more potent agents. So the lower the number, meaning the lower the minimum alveolar concentration. We don't need a lot of this drug in the alveola to get into the blood to have an effect. And the lower the molecular weight means the quicker it'll go. The lower the partition coefficient, meaning that it is easier for the gas to get into the blood. It means that these agents are going to be more potent, okay? But they are going to vary slightly between species. The partition coefficient is the solubility of the agent in a tissue, like blood, and it correlates with the speed of induction and recovery. Lower numbers are faster agents. Vapor pressure of an agent indicates how volatile it is and the maximum concentration that can be achieved. Higher numbers in vapor pressure indicate greater volatility and the need for a precision vaporizer. So here's an example of an inhalant. Exposure to this anesthetic waste gas can pose a health hazard to the veterinary technician, so you've got to remember that we need to scavenge the waste gas and stay away from that waste gas. Reproductive, hepatic, and renal effects have been noted, and toxicity is likely due to the biotransformation of byproducts of the agents. So biotransformation is metabolism. So here's an example of isoflurane, which has a low MAC, a low partition coefficient, but it requires a higher vapor pressure, so we need to have a precision vaporizer for isoflurane. So clinically, we're going to use this to induce and maintain. So induce through mask induction or chamber induction, or maintain general anesthesia in animal patients. Isoflurane. So there are only two inhalants we're really going to talk about. Isoflurane is a colorless liquid. It has a pungent odor. It is stable and does not require preservative. It's what we call a halogenated ether, but it's one of the least soluble of the inhalant agents. It's less potent than halothane and methoxyflurane, but has very rapid induction and recovery times. Less potent means it's it does take a little bit more time to get into the system than halothane or methoxyfluorine, but it's safer as well. It allows a stable heart rhythm and does not decrease cardiac output at clinically used levels. It's metabolized at a very low rate, so less than 0.2%. This agent is used in a wide variety of species. Sevoflurane is a halogenated ether as well. It has little odor, it's less odor than isoflurane. It's a good choice also for mask induction because when you do vaporize it, you don't smell it as much. This agent is characterized by very rapid induction and recovery times. Its cardiovascular and respiratory effects are similar to those of isoflurane. It's often used in high-risk small animal patients because we have a safe, rapid, smooth induction. Only 3% of sevoflurane is metabolized. The rest is just exhaled out. The disadvantage of the use of this agent is that it is more costly than isoflurane. Halothane is something that has been used in human anesthesia and then in animal anesthesia. We don't use it very much anymore. It sensitizes the heart to catecholamines, so it can result in cardiac dysrhythmias. It's similar to isoflurane and sevoflurane because it did have a high vapor pressure, so it needed a precision vaporizer, but it's metabolized, so it goes through the body at 25%, so it's not just breathed out, so it stays in the system for longer. We don't use it much anymore. Nitrous oxide is known as laughing gas. We don't use it very often, but it can be used as an adjunct to the other potent agents during mask induction to speed the induction of anesthesia. It cannot be produced, general anesthesia cannot be produced with nitrous oxide alone. We do need some other things to go along with it. So we use it as a carrier gas. It is more soluble than nitrogen. Nitrous oxide is more soluble than nitrogen, and it displaces nitrogen from the body, so that potentially can cause distension of the intestines and other gas-filled areas. We do want to deliver it with a flow meter and give it with oxygen as well. So it's going to be used as a carrier gas with oxygen, and we want to oxygenate them after we turn off the nitrous oxide. Some other miscellaneous central nervous system drugs. Propofol is a short-acting hypnotic. We don't know understand the mechanism. It's an emulsion that is made with soybean oil, glycerol, and egg lecithin. What a wonderful thing to grow bacteria in. It is a rapid and smooth induction. We want to give it slowly IV. If you give it too quickly, you're going to have respiratory arrest. Sedation, restraint, and unconsciousness is dose dependent, so we want to give it as to effect and as needed. One bolus will only last 2 to 5 minutes, so we usually use this as an induction agent. If we want to use it to maintain general anesthesia, we're going to want to continue to give them slow boluses or put them on a constant rate infusion. This is the drug that killed Michael Jackson. This drug was put into an IV bag and dripped at a certain rate. The doctor who did it calculated it wrong, so he killed Michael Jackson. So we use it for anesthetic induction. This is why it's important to know your CRI. CRI math is important. So anesthetic induction, outpatient procedures, because they can go down and wake up pretty quickly. We want to use it instead of barbiturates in sighthounds. I used to use it for everything. In animals with pre-existing cardiac arrhythmias, or if we have as a C-section medication, because it does not cross the placental barrier. We do want to watch for apnea. They'll stop breathing if we give it too rapidly. Sometimes we'll see some paddling or seizure-like signs. If we have cats with Heinz bodies in their red blood cells, it will cause if we're using it in cats with repeatedly, it will cause, Heinz body production in the red blood cells, make the red blood cells not work properly, and prolonged recovery. So don't use it in cats repeatedly. There are two forms, one without preservatives, so we need to refrigerate that, and the other one has antibiotics included, and that one is good for 28 days. The cupboard is okay. Most of the vets I know just put it in the fridge. It is not a controlled substance. There is another medication that falls in this group called Alfaxan. I don't have it here, but you can list it under this group. But it causes all the same. It's considered slightly more safe than propofol, but it's essentially does the same stuff. Guafenicin. Guafenicin is a skeletal muscle relaxant that works, we use in horses. It affects connecting neurons of the spinal cord and brainstem. In equine medicine, we use it with induction of general anesthesia or to extend anesthetic activity if we're giving field anesthetic or injectable field anesthetic. So we're doing it in the field. It is dose dependent. It comes as a soluble powder. We have to dissolve it in a diluent, and generally that diluent is warm 5% dextrose. So we're going to warm that up and then use that diluent with that powder and mix it up. It's just like making hot cocoa. Think of it that way. Hot cocoa in cold water doesn't mix really well. We want to mix immediately prior to using because it will precipitate within hours. And of course, we're mixing it with dextrose. If we're mixing it with dextrose, that's a place where bacteria will want to grow. We want to communicate with veterinarian as increments are administered to maintain or extend anesthesia. This drug is also, we're going to see it in the respiratory tract. It's also a mucolytic. It's the active ingredient in Mucinex. Mucinex is that medication where you see that mucus cartoon character on the commercials. Doxapram or Dopram V activates the respiratory center by stimulating respiratory centers in the medulla. We named this as an adrenergic drug. It is labeled for dogs, cats, and horses. Its main indications are to stimulate respirations during or after general anesthesia, and it's used in newborns, if it's C-section, and in cases of cardiopulmonary arrest. So this is in your emergency crash cart. We can use it IV, but we can also put it sublingually under the tongue or into the umbilical vein of the newborn. So in your crash cart. Some muscle relaxants, these are neuromuscular blocking drugs. They interfere with neuromuscular transmission of impulses and are used as an adjunct to general anesthesia. They do not produce analgesia or sedation, so they're only used with analgesia or sedation. They can stop ventilation, so they can block the diaphragm and the muscles which help with ventilation. Okay, so this is an example of, here's acetylcholine coming into this nicotinic receptor at the neuromuscular junction, and it's trying to cause an effect here and open up those sodium channels so we can get some contraction here. But now we have tubocurarine, which comes in and it blocks it. Okay, and so it's going to keep acetylcholine from causing an effect. Okay, curare, tubocurarine, curare is what you find in those poison darts that you've heard about in stories or on movies. This is a poison that causes paralysis of muscles, specifically paralysis of muscles that allow you to breathe. Okay, so they are depolarizing agents. There are depolarizing agents. They're similar to how acetylcholine acts at the neuromuscular synapse, but they last longer and they cause muscle paralysis. That's called a phase 1 block. There are also non-depolarizing agents that prevent, through competitive inhibition, acetylcholine from binding to the receptor sites. This is called a phase 2 block. We use them as an adjunct to general anesthesia, especially ophthalmic or orthopedic procedures where we need those muscles to not move while we're doing the procedure. We can also use them to facilitate endotracheal intubation. So if we have an animal with a laryngospasm and we need to stop that laryngospasm, we can use these medications to do that. They can also be used just as muscle relaxants, so as not stopping the muscle completely from contracting, but just allowing them to relax. Okay, so methocarbamol or Robaxin or cyclobenzaprine or is Flexeril. Those two are muscle relaxants as well. Some behavioral pharmacotherapy, behavioral problems that we see in pets that we can treat with drugs: separation anxiety, fears and phobias, unruliness and hyperactivity, compulsive disorders, cognitive dysfunction, and inappropriate elimination cats. So, we can take them to the shelter, or we can do behavior modification, and or we can do pharmacotherapy. Monoamine oxidase inhibitors. That's the first thing that we're going to talk about. So what's monoamine oxidase? Monoamine oxidase is that chemical that breaks down norepinephrine at the receptor site, right? We do have to be very careful when we're using these drugs that they're off-label or extra-label. We need informed consent. We need to tell the client that we're using this drug, that it's not been tested necessarily in the animal that we're using it for, or for the thing that we're using it for. I absolutely need commitment from the owner that they will do behavior modification first. These drugs will not work without the owner taking responsibility to help the animal learn a new behavior. Where do these drugs work? They work at the neurotransmitters activity in the brain with acetylcholine, dopamine, norepinephrine, serotonin, and GABA. So monoamine neurotransmitters, dopamine, norepinephrine, serotonin, these are found in large quantities in the area of the brain, often associated with expression and control of emotions. These are inactivated by drugs that inhibit or block monoamine reuptake. So that increases that neurotransmitter activity. Acetylcholine is the most widely distributed neurotransmitter in the body. It has a variety of behavioral effects: plasticity, so being able to adjust or handle adjustments or changes in the environment; learning and memory; sustaining attention; arousal and reward; enhancement of alertness, and enhancement of alertness when we wake up. It's inactivated by cholinesterase. Some side effects of acetylcholine, it would be dry mouth, tachycardia, urine retention, and constipation. Gabapentin, right, is inhibitory. It's also widely distributed in the brain. I'm going to go out of this and make sure that I have all of this chart up here. Yes, I do. Okay. So that's what I have for GABA. Benzodiazepine, their mechanism of action, so we're talking lorazepam here, or Valium, alprazolam. They bind and promote GABA activity in the cerebral cortex, subcortex, and limbic system. Side effects would be lethargy, ataxia, PUPD, hyperexcitability, and hepatic necrosis in cats. So we do have to be careful with cats. The uses would be fears, phobias, separation anxiety, aggression, anxiety-induced stereotypes, urine marking in cats, and appetite stimulation. Azopurones, or buspirone, also known as Wellbutrin, the mechanism of action is it's a serotonin reuptake inhibitor. So it does not allow serotonin to be taken back up and put back. So it keeps the serotonin in place, keeps the neurotransmitter in place, and increases and prolongs its effects. There's no muscle relaxation, it's not it's an SSRI with no muscle relaxation. It is also an anticonvulsant. It has some sedative effects. It can help with urine marking, spraying, and control of fearfulness and anxiety. Tricyclic antidepressants, so another category, includes amitriptyline, imipramine, and clomipramine. Clomipramine has been actually tested in dogs for separation anxiety. It's called Clomicalm. Mechanism of action is to prevent reuptake of norepinephrine and serotonin. So it's used for separation anxiety, obsessive disorders, lick granuloma, tail chasing, fearful aggression, hyperactivity, hypervocalization, and urine marking. It is a long-term treatment because it can take several weeks for it to actually be effective. So once I start this medication, they're going to be on this medication for at least 3 months before I will tell them to let them know whether it's working or not. Adverse side effects would be sedation, tachycardia, heart block, dry mouth, so we have a arrhythmia or slow heart, dry mouth, reduced tear production, urine retention, and constipation. Selective serotonin reuptake inhibitors, SSRIs, include fluoxetine, which is Prozac in human medicine, but it's also labeled for dogs as Reconcile. Sertraline is Zoloft, paroxetine is Paxil, and fluvoxamine is Luvox. And the mechanism of action for this is that it increases the amount of serotonin in the synapse by inhibiting its reuptake into the nerve terminal. Similar to tricyclic antidepressants, but fewer potential side effects than tricyclic, but they're usually more expensive. So we do need to be very careful of that with our humans. Monoamine oxidase B inhibitors, MAOB, not MAO, just MAOI. This one is Anapril or selegiline. This is used for a number of different things. It's used for Cushing's disease, but also used for the treatment of cognitive dysfunction syndrome. This breaks down dopamine, and when we have decreased dopamine, we have dementia or cognitive dysfunction. So treatment of CDS is it treats this disorientation that they have. It treats that decreased activity level, the abnormal sleep-wake cycles, the loss of house training, decreased and altered responsiveness, and decreased or altered greeting behavior. So it helps them to make connections that they lost with the dementia. It's also used in the treatment, like I said, of Cushing's disease. Cushing's disease is that endocrine disease that can cause the release of adrenocorticotropin hormone. Euthanasia agents, usually using pentobarbital, should rapidly produce unconsciousness without struggling vocalizations or excessive involuntary movements. So they should go through that stage 2 of anesthesia very, very quickly. Death should follow quickly, owing to the cessation of all vital functions such as respiratory and cardiac function. It can be combined with other agents such as propylene glycol and alcohol. It is pentobarbital alone is a class 2 controlled substance, but the combination is a class 3 substance. Make sure that you're making flashcards. You need to categorize your flashcards by what the mechanism of action is. So is it a cholinergic, a direct acting cholinergic, or an indirect acting cholinergic? Is it an adrenergic? Is it an anticholinergic? Is it a benzodiazepine? And is that a tranquilizer or a sedative, or is it an analgesic? You need to be able to draw these lines between all of these drugs. Tell me where they work in the nervous system, how they work with the animals, and then remember all those little tiny details of, hey, this drug we have the reverse action of this drug with cats and horses. So those little things. Make your flashcards, put them on StudyMate Campus, so you have this constant review that you can do as you're going through this information.